So we did a second degree burns, and my group is Maddie and Liz and myself. So second degree burns consists of a burn that involves both the epidermis, which is the top layer of skin, and then the dermis, which is the middle. So the layer it does not involve is the hypodermis, which is a third layer. It's also known as a partial thickness burn. So in other words, it doesn't burn all the way through all three layers. There are different types of second degree burns. The first is superficial and the second is deep. So superficial burns involve the epidermis and dermis, but does not go all the way through the dermis. It's only like kind of the top layer of the dermis. These are very painful because your nerves are still intact. Often they'll be red and they almost always produce blisters. They are usually caused by hot water or hot objects. So if you're making spaghetti and you're gonna like pour out the boiling water into a strainer and say it slips and you spill water on yourself, hot water on yourself, that can often cause a superficial burn. The second type is a deep burn. So deep partial thickness burns are second degree. They are not full thickness burns or third degree. So this is different. They are deeper than superficial because they'll go deeper into the dermis. They're less painful because more nerves are damaged. And instead it's kind of like a pressure. They'll be reddish, even whitish skin. Can often look even waxy. And this has a lot higher risk of infection because you have more skin that is damaged. So these are some of the symptoms. There are blisters, which will swell. And this is used as a way to heal so it can protect the skin as it is healing. It'll often cause severe pain because of nerve stimulation and damage. Second degree burns do not always result in scarring, although it can happen depending on if it's superficial or deep. As the skin around the burn will heal, it will heal abnormally in color and shape, which is what results in the scar. It also may appear red, white, or tan. So when admitted to a clinic or a hospital for a burn, these are the assessments or the things that the provider will want to collect and first assess. So the first thing they'll do is take your vitals, which should be done anytime a patient comes in. The second thing they'll do is assess your level of consciousness. For example, are you hyperventilating? Are you in shock? How much oxygen are you getting? The next thing they'll assess is the burn itself. So they'll look at the severity, the depth, circumference, how it happened, whether it's fire, chemical, when and where the accident happened. So did this happen yesterday versus today? Does it look infected? And even where the burn is located. So is it on your face, arm, leg, etc. Then they'll want to collect baselines. So baselines include like what blood type you have, how much circulation you're getting. So is the area really affected that the blood flow is not good anymore? They'll monitor your heart. So the baselines usually include the ABCs, the airway, breathing, and circulation. Those are always the first things you want to assess. So there are many different causes for second degree burns. There are 6 classifications of burns that are generally caused all by preventable accidents. So the first is a scald. A scald can happen as a result of like liquids, grease, or steam. Contact burns are touching a hot pan or something coming from the oven without an oven mitt. Then fire, chemical, so like strong acids, or lye, which is like a certain type of cleaner for drains. And then it can be electrical or radiation. So thermal burns are the most common type of burns. These are the scalds, the contact, and the fire. Chemical burns may occur by contact with, ingestion of, or inhalation of chemicals. So real life examples of causes include severe sunburn, which is radiation. As I said earlier, spilling boiling water on your arm is a scald. Being stuck in a burning building obviously is fire. Some risk factors are age and gender. So burns are more likely to occur in males between the ages of 20 and 29, followed by children under the age of 9. And the reasoning behind this is because males are often involved in accidents such as electrical, chemical, or work-related stuff, and young children are susceptible, especially to electrical burns because sometimes kids will chew on electrical cords, and they might play with fire, such as lighters or matches that have been left around. Diagnosis is pretty simple. You usually just make it via the assessments that we talked about earlier. So you utilize most of your senses. So key indicators of diagnosing a second-degree burn are blisters, deep red, white, and discolored patchy skin, if it's wet or shiny, and if it's painful to touch, because that means the nerves are still there and they're not damaged too badly. The treatment depends on severity and location of the burn. So mild second-degree burns may be treated with following techniques. You can run cool water for 15 minutes over the burn, and it's important not to do cold water because extremely cold water can damage the already sensitive skin. You want to drink plenty of water or sports drinks to replenish the lost electrolytes and prevent dehydration, which is common. You want to cover it with gauze to prevent breaking the blisters. And you also want to cover the burn to prevent any chances of infection. A severe second-degree burn should be treated by a doctor. A doctor might clean and debris the burn if any clothing or objects might have gotten melted into the burn itself, because that needs to lower the risk of infection. A doctor may prescribe antibiotics to prevent infection as well, and you might need skin grafting, which removes healthy tissue from, say, an area of skin on the stomach or a leg, and will put it on the damaged skin so that new skin can form over it. Most of the severe second-degree burns all deal with infection and trying to prevent that. Prognosis and follow-up. So prognosis generally heals fairly well. You usually don't need to worry, especially if it's a superficial type of second-degree burn. The follow-up involves a lot of teaching and education. So you teach your patients how to deal with issues outside of clinic, such as if there was scarring, if there's tissue or skin grafting, then maybe looks from other people. You might get second glances. You also have to teach patients wound care and pressure garments, pursue ongoing therapy if there were respiratory issues, such as if the burns were in the lungs or had blood flow. We also alert the patient about resources for recovery. So like I said, it's mainly education. If the damage is deep enough though, they might need physical therapy. And yeah, that's that.